Hi, this is Dr. K.L. Goldfarb at Water and Sports Physical Therapy. This week's tip is talking about labral tears. We've had questions about a slap lesion or a Bankart lesion. These are both lesions or injuries to the labrum. So let's quickly discuss what the labrum is and what it does. The labrum, if you visualize the cavity which the humeral head sits in, the glenoid cavity, it is not very deep. So in order to increase the depth, you have a fibrocartilaginous ring, triangular fibrocartilaginous ring that wraps around that cavity. That increases the stability of the shoulder, because the shoulder is a very mobile joint. So therefore, when you do move in certain positions, it can help increase the ability for the humeral head to stay in place, along with other structures like the rotator cuff. So if you have certain injuries, usually for these labral tears, typically your injury is behind your body and you go back this way. That usually causes tearing of the labrum, usually the front and top part of the labrum. So imagine this ring not giving the stability. When you move your arm behind you, when you internally rotate behind you this way, fully, or rotate upwards, your humeral head will shift forward. If you don't have the extra stability of the labrum and your rotator cuff isn't functioning properly, you can actually shift and have a subluxation or a dislocation of the humeral head out of the normal position. So, very important to get this diagnosed correctly by a physician or doctor of physical therapy to make sure we're looking at the correct diagnosis. You don't want to just start doing exercises that can cause more problems. But if you are diagnosed with a true labral tear, there's a few things you want to remember. Avoid those positions behind you. Do not lift things with your hand down, reaching behind. Do not grab things behind this way. If you're exercising in the gym and working out, you want to avoid things like bench press where your elbows go behind you. You want to keep your shoulder and elbow in line and don't go behind the shoulder position. That'll put less stress in the labrum. As far as the basic strengthening exercises go, what you want to focus on is the muscles that stop the humeral head from moving forward. The subscapularis is important. The latissimus dorsi is important. The rotator cuff in general, supraspinatus, is important. But let's talk about the ones in the front and how to exercise them. So if you can, in your home or in a gym, have access to a TheraBand, this is one way to do exercises. So you'd have this set up in the top of the door, and if it's your right shoulder you're looking at, what you'd want to do is start, if it's an asymptomatic shoulder, meaning you're not painful in these positions, you want to start out in a position where you have some good tension. You want to slowly come back. You don't want to go back into that fully externally rotated position. You want to pull down and back up. And you want to really work on the subscapularis, your internal rotators, to make sure that when something happens where your arm goes behind you, it slows that motion down. What you want to do is have that control backwards. So when you're here like this and you pull down, you do a lot of repetitions. You can increase the tension, but again, don't go too far behind you. You also want to work your pecs and your stabilizers in front, so you can work at different angles. If you're a pitcher or a above head thrower, you want to focus eventually, if pain-free, on exercises above, through here, even on small motions like this. You can do small perturbations. If something pushes you back, you want to control that motion. You can take a ball against a wall and you can just push into the wall or into the ball and controlling these different angles of motion. So again, these are a few exercises that we do in rehab, but get a true diagnosis. Make sure you know it is a labrum. The average labral tear goes undiagnosed for 2.5 years. So it's a little more difficult to diagnose, definitely not on your own, but even good clinicians mix it up with other pathologies. So make sure you get a good diagnosis and you'll take good care of yourself. Good luck. Any questions, you can find us at waterandsportspt.com. Thanks.